Today, we'll be presenting my team's assessment for medical surgical nursing. My group consists of myself, Isabella, Madeleine, Sarah, and Angela. We have chosen community-acquired pneumonia to talk about and present our concept map on this topic. We'll also be discussing the pathophysiology of community-acquired pneumonia, risk factors, signs and symptoms, diagnostic testing, clinical management in the hospital setting, and medication management. Here is the concept map that me and my group have created. In the dark green on the left-hand side is the pathophysiology of community-acquired pneumonia, leading to the signs and symptoms, which is then purple, which then leads to risk factors in pink and clinical management in turquoise. The clinical management then also leads to medication management, which is the dark blue section of the concept map. There is also the diagnostic testing, which is in light blue, and complication, which is in yellow in the top right-hand corner.
Pathophysiology of community-acquired pneumonia has been observed as an infection of the lung parenchyma, fundamentally caused by bacteria or viral respiratory pathogens. Respiratory pathogens are transferred from person to person by droplet or aerosol inhalation, for example, as with the Legionella or Coxiella species. Following the inhalation, the pathogens colonize in the nasopharynx and then enters the lung alveoli via microaspiration. When the inoculum size is sufficient and/or the host immune barriers are damaged, an infection is caused. Replication of the pathogen, the making of the virulence factors, and the host immune response led to inflammation and damage of the lung parenchyma, resulting in pneumonia.
Risk factors associated with community-acquired pneumonia include age, smoking, environmental exposures such as air pollution, allergy exposure and viral infections, asthma, COPD, chronic bronchitis, immune suppressive therapy, functional impairments such as dementia.
There can be many signs and symptoms associated with community-acquired pneumonia. These signs and symptoms can include a high fever, chills, cough with sputum or phlegm, shortness of breath, pleuritic chest pain, blood in sputum, hypotension, tachycardia, fatigue, aches, pain in joints, headaches, decreased appetite, mood swings, nausea and vomiting.
Diagnostic testing associated with community-acquired pneumonia includes a physical exam, respiratory rate and breathing sounds, AGB, which is arterial blood gas, sputum cultures. Blood cultures may show transient bacteria, blood tests, electrolytes, sodium and chloride levels may be low, chest x-ray looking for signs of consolidation and fluid exfusion.
If a patient were to be admitted into the hospital to be treated for community-acquired pneumonia, there are different types of clinical management that the patient would be receiving by the healthcare team within the hospital setting. Clinical management of community-acquired pneumonia includes receiving a bronchoscopy, a chest x-ray, participating in breathing exercises. They will be also encouraged by the healthcare team to sit up out of bed and encourage them to not lie flat in the bed. They may also be administered medication and intravenous fluids, as well as oxygen therapy. The healthcare team would also be taking blood tests from them, encouraging an oral fluid intake to prevent dehydration, and the patient would also be participating in physiotherapy sessions. The healthcare team would also encourage the patient to quit smoking, and if worst case scenario, if the patient has severe community acquired pneumonia, ICU management will be considered.
Medication management for community-acquired pneumonia includes oxygen therapy, IV antibiotics, IV fluids to prevent dehydration, paracetamol or ibuprofen for fever, and pneumococcal vaccinations. Complications associated with community-acquired pneumonia include bacteremia, which is bacteria in the bloodstream, difficulty breathing or extreme shortness of breath, pleural effusion, which is accumulation of fluid around the lungs, and lung abscess.